More than 22,000 people have been displaced in Somalia due to intense fighting. This includes over 11,000 children. Thousands have been cut off without basic services. And to speak to us further on this situation in central Somalia, we are joined on the line by Francesca Sangiorgi, Humanitarian Director for Save the Children Somalia. Francesca, good afternoon and thank you for joining us on Africa Update.
Thank you so much for having me.
Now, what is the situation currently on the ground? What are the people they're facing?
Thank you. The situation is quite critical. We've had reports of very high number of displaced. As you mentioned, the latest was over 22,000, half of which are children, moving from the city of Mahas into other areas of Hiran region. And the situation is critical because there is overall overcrowding. So a lot of the displaced population are staying with host communities in the location where they've moved. The overcrowding is a protection risk, especially for women and children and any other vulnerable group. It can also cause the more easily spread of diseases. There's also, especially in rural area, lack of access to safe water and safe sanitation. Again, the overcrowding condition also caused an issue in terms of sanitation and a high number of people having to share sanitation facilities. We're also seeing increased reports in terms of protection risks that the displaced populations are facing. And then also health risks and malnutrition increasing. And again, the services are now facing higher number of people coming. So the overall health services are being put at strain. And already we're seeing reports of increasing malnutrition across the populations that have moved.
Now, Save the Children is concerned that 21 health sites you support are currently suspended due to this ongoing conflict. Tell us more about these centers and how they contribute to the communities they serve.
Thank you. Yeah, that's correct. So we have a number of health centers in areas that are no longer accessible that had to suspend activities. And as I mentioned, what it means is in areas where there's still access and population have moved to, the services are put under a lot of strains. So for the population who have moved, we have services that are overburdened, and for the population who have stayed behind, now there is a lack of access to essential and life-saving both health and nutrition services that we were before able to provide in these areas.
And how are the aid cuts affecting Save the Children in Somalia?
Yeah, so aid cuts have had a very large impact across all partners in Somalia, both NGOs, UN partners. In our case, we have over 370 health and nutrition services that have been ended this year because of the funding cuts. High number of health facilities had to shut, around 100 of them. So in a countries where we face a very high disease burden as well as severe acute malnutrition. Just this year, there's 1.8 million children under 5 in Somalia that are suffering from acute malnutrition. It's a recipe for disaster.
And what is the Somali government doing with regards to what their contribution is to this crisis on the ground in the central part of the country?
So the government and all actors providing humanitarian assistance are currently scaling up in areas affected by conflict, but also are trying to look for different resources where the funding cuts have impacted the provision of essential and life-saving services and commodities. So there's a lot more discussion ongoing with, for example, the private sector, with diaspora community outside of Somalia, to be able to still resource these essential services. In terms of this specific crisis, there's a gap on the ground right now that we're seeing. We are also trying to scale up and being able to provide support to the population that have been displaced. But the gaps and the needs remain very high.
And Francesca, I can imagine the sort of stories that you're getting to hear from the people who are impacted and affected by this crisis.
Yeah, absolutely. So just this week, we were on the ground talking with community leaders, talking with displaced population and local authorities to hear more from them. And what we heard was a huge problem around overcrowding. So a lot of people have now settled back with host communities. And we had one person telling us that in one living room, there were 5 families residing together right now. There's been report of concerns around protection because of this overcrowding, as I mentioned earlier. And we also heard reports, especially from community leaders and local authorities, in regards to the concerning health and nutrition situation on the ground.
And the impact on children, mainly children and women, because in any crisis where there's a conflict or any type of disaster, the most impacted people are the women and children. What are they saying?
Yes, absolutely. So again, the lack of shelter and privacy is a big concern that they've raised to us because it can further put them at risk of abuse, at risk of gender-based violence. So that was a big concern. They came out when we were on the ground this week. For the children, again, when moving, especially due to conflict, there is high chance of family separation, which is a huge protection risk, but also neglect. We're also hearing reports about difficulties in having enough food to eat. So most of the families we spoke to this week told us that they were having 1 meal per day due to having to leave behind their assets and not having any income in the place where they've now settled.
Mm-hmm. Well, Francesca, because of time, we are going to have to leave it here for today. But thank you so much for joining us on Africa Update.
Thank you for having us.
That was Francesca Sangiorgi, Humanitarian Director for Save the Children Somalia, joining us on the line. It is 12:30 and our news headlines up next with Onel Nzinzi.
SABC News headlines.